Today's video is about vascular disease. We will be breaking down key clinical clues that can help coders identify possible PVD in the chart so that they can recommend to the providers. This is simply an overview also of what vascular disease is. I hope you enjoy. Here is our disclaimer. We are not doctors or any type of medical professional outside of just a certified medical coder sharing educational information based on the coding guidelines and off of our experience. This video is for informational purposes only and not medical advice. So here in this video, our learning objective is to identify what is vascular disease, what are the symptoms, causes, risk factors, how to diagnose and treat, and then also the clinical indicators for our coders to recommend to the providers. So what is vascular disease? Simple. It's a blocked, narrowed, or weakened blood vessel in our body. It impacts the aorta, brain, the kidneys, legs, and so much more. So much more. I mean, different parts of the body, different components of the body, it can definitely impact. Vascular diseases are very, very common in America, partly because so many of us are overweight. We weigh too much, and most of Americans, maybe 80 to 85% of Americans are diabetics. Today, we will definitely focus on the most common vascular disease, which is PAD, peripheral artery disease, and carotid artery disease. Strictly focusing on the PVD though. PVD is a slow and progressive disorder of the blood vessels. It's a narrowing, blockage, or even a spasm in a blood vessel that causes it. PVD may affect any blood vessel outside of the heart. This includes the arteries, veins, or even the lymphatic vessel. Organs supplied by these vessels, such as the brain or legs, may not get enough blood flow for the healthy function, and the legs and feet are the most often affected. PVD is also called PAD. The most common cause of PVD is atherosclerosis. This is simply a buildup of plaque inside the artery wall. Plaque reduces the amount of blood flow to the limbs. It decreases the oxygen and the nutrients sent to the tissue. Um, Due to that, the blood clots may also form on the artery walls. This makes the inner sides of the blood vessels even smaller, and it blocks off the major arteries. Other causes of PVD may include injury to the arms or legs, irregular anatomy of the muscles or the ligaments. It can be caused by infections. And then the people with the CAD, which is coronary artery disease, often have PVD as well. As far as the symptoms, about half of the people who are diagnosed with PVD, they really do not have symptoms. But for those that do have symptoms, most common will be pain in the leg, cramping when they go and exercise. But once they stop, the pain is relieved. Um, that's called intermittent claudication. Um, Other symptoms, change in the skin, including decreased skin temperature or thin, brittle, shiny skin on the legs and feet, weak pulses, hair loss on the legs, numbness, weakness, or heaviness in the muscles, reddish blue discolorations of the extremity. It's a lot of different other symptoms that a patient may have, but a lot of times the symptoms are um, unnoticeable. While some vascular problems, the cause isn't known, vascular disease causes includes high cholesterol, high blood pressure, smoking, um, or using tobacco products. Diabetes is one of the most common Hereditary medicine. It can be caused by injuries, infections, and blood clots. But the top risk factors are high cholesterol, high blood pressure, smoking, and someone who is a diabetic. To diagnose these conditions, the provider most of the time will ask the patient about their medical history. Then they will give them a physical exam, check their lower extremity, and if they find abnormal findings, this is where they will order some type of screening. You have the ultrasound, the vascular ultrasound, the catheters, the angiography, CT, MR, and then the most simple testing will be an ABI, which is an ankle brachial index. And that is basically the comparison of the blood pressure in the ankle with the blood pressure in the arm. It's done on a regular, and that is the most common to identify PVD. The treatment for vascular disease, it can be managed and treated by stopping smoking, having a healthier diet, exercising, managing stress levels, medication, surgery, and managing the blood pressure. Um, the main goal is to control the symptoms so that everything else can be in control. Um, if these things are not in control, it's a higher risk for heart attack and strokes. So the treatment, again, it can be the lifestyle change to control the risk factors, medicine to improve the blood flow, angioplasty, vascular surgeries. Those are the things that can treat vascular disease, but the best option will be in healthier diet, stop the smoking, and exercise. Let's get to the fun part. Diabetes with PVD. So, especially type 2 diabetics, they have a higher chance of developing PVD. Um, it leads to a poor circulation. This is one of the top manifestations of diabetes. The causes heavy cramping in the legs, which is the claudication. The patients they have pain in the lower legs, especially when walking. Reduced hair growth on the legs and feet, discoloration, coldness on the skin, and then they have wounds that are not healing properly. Um, the ABI is what is used to diagnose the patients. It's not required to code, but when you are recommending diabetes with PVD or you suggest a provider to work that patient up for it because they have risk factors, you're going to check the ROS, see if the patient have leg pain, if the patient have heaviness in the legs, any claudication, any diminished pulses, cold skin, hair loss, or is the skin shiny? And if that is, you have maybe 2 out of 5 symptoms or risk factors, I would recommend it to the provider. And then when you are recommending, you're going to use E1151, which is diabetes with PVD. It's HCC category 18 and 108. Do not suspect PVD within 3 years of a negative ABI unless there are new risk factors, symptoms, a pending workup, or borderline results. Please, if you do not see that the patients are on medication or they have any symptoms, please do not continue to document the PVD if there's negative ABIs. So this is the end of the video. I hope that you all enjoyed it. And if you did, please like and comment. If you would like a more in-depth or detailed video knowing how to recommend HCC category 108, Please leave a comment on what you would like us to discuss, and we will create one for you. Again, thank you for taking the time out to watch our video. And like always, we truly appreciate you all. Thank you.